Maybe I repeated it too many times. Thing to note that
One eternity later.
Hi, I'm Jensen. I'm currently a respiratory and critical care physician at Changi General Hospital, and I've been working as a doctor for the past 20 years.
Hi, I'm Cheryl, one of the Year 1 residents in CGH.
Hi, I'm Shu Wei. I am a Year 1 internal medicine resident in Changi General Hospital.
Chronic Obstructive Pulmonary Disease, also known as COPD, is a chronic inflammation of the lung that results in people feeling out of breath, and this condition is chronic and progressive in nature. So there are many key treatment and preventive strategies to help people with COPD, and one of the key measures is vaccinations that people with COPD should get.
Hey, that's pretty good.
As per the last video, we will play a game where we vote on things that we may have encountered through our years of learning and treating patients with COPD.
And after that, we'll be watching a short clip about vaccinations in COPD patients. So let's begin!
Never have I ever encountered a patient who thought that vaccines lasted a lifetime. So I have. So there are quite a number of patients who actually believe that vaccinations do last a lifetime, and there are some vaccinations that can last a lifetime. But many of the vaccinations, especially vaccinations that prevent lung infections, unfortunately they do not last a lifetime. And one of the key reasons is that the virus or the bacteria, especially the viruses that causes chest infection, especially in patients with COPD, they mutate frequently.
No! God, please, no! No!
Like, for example, the influenza vaccinations, which are once yearly, some patients think that they last a lifetime.
Confirm have. So there are some patients who will say, 以前打了，为什么今天还要打? So it's like, why last time got vaccination already, why now still need? But we need to update ourselves on this kind of vaccinations because they might cover you for different type of diseases.
Oh, okay.
Never have I ever had a patient refuse to take vaccinations. Actually, I have not. I always make the uncle promise me that he'll take the flu jab, then he'll take.
Definitely, there are a lot of patients who doesn't want vaccination. I think some of the common reasons are like they're scared of needles, they don't feel it's necessary, they don't want to undergo the pain or the anxiety of having to take vaccination. In fact, one of the common misconceptions that people with COPD have is that their lungs are weak to begin with, so all the more they shouldn't be taking these vaccinations or these injections which could be too strong for them. And I often tell them that all the more because their lung function is weak, they will be very sick if they come down with an influenza infection or pneumococcal infection.
Do it! Just do it!
Never have I ever encountered a patient who thought that vaccinations could prevent the cold.
This is quite a common misconception that I have. In fact, many of my patients who come and tell me, I've taken the vaccinations last year and I still get the running nose, the sore throat, the cough. And I think it's important to note that the vaccination cannot prevent your running nose, your cough, your sore throat. But what the vaccination is key is preventing a person, especially with COPD, to come down with severe pneumonia such that they have to be admitted to hospital, be on a mechanical ventilator to breathe. And that's where the importance of vaccination is.
A few moments later.
Everybody say the same, but this is my natural look.
Warning! This video is commentated by a medical professional. Do not try this at home.
Her whole face just got swollen like this overnight.
No fever. Glands normal. Missing her vaccination dates.
We're not vaccinating.
The mother is just very concerned, but at the same time very misinformed. It is quite important for our patients to speak to the medical doctors at a personal level to understand what are the risks and benefits of vaccinations, and in fact we are very happy to do so.
You know another really good business? Teeny tiny baby coffins. You can get them in frog green, fire engine red. Really. The antibodies in Yummy Mummy only protect the kid for 6 months.
Oh my god, that's quite mean. But actually there is some truth in what he's saying, because natural immunity will only get us that far, and anything further actually we would require immunizations, vaccinations to sort of boost our immunity.
A few hundred parents like you decide they'd rather let their kid die than cough up $40 for a vaccination. Believe me, prices will drop really fast. Ribbit, 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 ribbit.
Tell me what she has.
A cold.
That's an interesting episode from House. I think with regards to vaccination, there are a lot of perspectives as well as theories out there. And the important thing to note is that vaccination is one of the key preventive measures of protecting people with COPD from getting severe pneumonia and being admitted or being placed on a mechanical ventilator. Some people might say that vaccinations are not 100% effective, and they are not 100% effective. In fact, influenza vaccination effectiveness ranges to about 50% on average. And do remember that if you do not take the vaccination, then your protection is as good as 0%.
You don't scare me!
For patients with COPD, preventing pneumonia from occurring is very important, because once pneumonia has occurred, especially in patients with COPD, their lung function deteriorates further. We hope you have gotten some interesting learning points from our video, and we would like to encourage everybody to adopt a healthy lifestyle.